Hi guys, Toby here with the Physio Studio in the first of a short video series talking about tennis elbow, or pain on the outside of your elbow. Today's video is just going to be talking a little bit about what exactly tennis elbow is, how to know if you might have it, and then some simple ways you can begin to treat it if you do. So as we mentioned, tennis elbow is a pain on the outside of your elbow here, originating in what we call the common extensor tendon. So where your extensor muscles on the top of the forearm all blend down and attach onto that elbow is where you'll be experiencing the pain. As with any tendon problem, it occurs when this tendon is overworked or not able to recover to the demands you're placing on it. So perhaps if you're doing a lot of gripping or lifting in this manner, a lot of typing, or perhaps redecorating or painting, things that require a lot of wrist and elbow movement can be putting the load here that it's not able to tolerate. Some ways to tell if your elbow pain is a tennis elbow: you'll most likely have pain with the activities I mentioned there, so gripping, especially with the palm facing down, anything repetitive with your wrist or elbow. As well, to test yourself, you can attempt to press your wrist upwards like this, so using your own other hand to press down on that hand, attempt to press your hand upwards. And if this reproduces pain on the lateral side of your elbow, it's more than likely a tennis elbow you're dealing with. If so, the first line of treatment is going to be relatively simple. To allow that tendon some time to just begin to heal and stop the loads that are being placed on it, you're going to avoid those aggravating activities. So as I mentioned, any heavy gripping or lifting, a lot of repetitive things with the elbow, avoid those with this arm as much as possible. Attempt to use your other arm to give it a break and allow the tendons to start healing up. Otherwise, other simple tips you can do are attempt to ice this area 5 to 10 minutes at a time, several times in the day if possible, to settle down some of the inflammation going on in there. And third of all, one simple exercise you can start with that can be quite good for reloading this tendon but also dulling some of that pain is just what we call isometrics. So where you're contracting the muscles but without any movement occurring at the wrist. And the way you can do this, the same way as we tested it, when you're here, having the elbow bent to take some of that pressure off if the elbow's straight, you're going to attempt to press your wrist upwards against your hand. So you'll provide the resistance and you can grade and scale it as you see fit depending on your pain. You'll hold this for 10 seconds at a time and repeat that for anywhere up to 2 to 5 sets. Give it a go and stay tuned for the next episode.